So it is my great pleasure to introduce our first plenary speaker for JBI Ignite, joining us from South Africa to present on transforming evidence for policy. Professor Ruth Stewart is the founder of the Africa Evidence Network and the recently appointed Director of Global Impact for the Future Evidence Foundation. Ruth has played an instrumental role in establishing the field of evidence-informed development and in establishing the concept of evidence networks. Throughout her career, she has worked across academia and government with the goal to engage stakeholders in her research using a wide range of approaches. So please join me in welcoming Ruth.
I'm not quite sure how to follow our fantastic colleague, Jack, but I would like to recognise that I'm here from South Africa and very much part of a culture of colonising. My family have for many generations lived around the world with a huge amount of privilege, and so it's a real privilege to be here and to have been introduced by such an extraordinary presenter. So thank you very much. I have some slides for you, and then we're going to have a chat. Bianca and I are going to sit by the fireside. You have to use your imagination. Sit by the fireside over here and have a nice chat. So let me begin. I have some slides for you, and I have bright colours on. I am very jet-lagged, and I'm guessing I'm not the only person in the room. So we will keep ourselves energized and inspired today. So I want to talk to you about transforming evidence for policy. Now, I mentioned that I live in South Africa, but I've actually lived all over the world. And listening to Jack presenting just now, I realized that the phrase I often use, and probably applies even more to him, is that of a global soul. I've lived in all sorts of different places and for different reasons, and these are perhaps the main places where I've lived. I was born in Malawi to missionaries. I studied in the UK. I had an opportunity for a work placement in Malaysia and lived there for a year. And I'm married to a South African, and I'm now based in South Africa. So I have many homes and many strands to what makes me me. But when I come and stand before you, and again, I feel inadequate having just heard our first presenter, but I come here and my goal, if you like, is to be authentic. Because if I can't bring to you what I have genuinely learned myself, then how can I ask you to pay any attention to who I am and to take on board what I have to say? So I want to do my best to encourage all of us to think about humility and respect, and in doing so, I need to practice that as well. So I want to recognize the extraordinary expertise that we have in this room from all over the world, and how amazing it is to be here and to be able to listen and learn from you. So I might be on stage, but really I hope that we can have many conversations over the coming days, because I recognize the extraordinary expertise and in some cases real struggles that each of you have gone through in learning what you know. And this is about sharing, not about me teaching you in any way. They used to call us mish kids, these children who grow up around the world with missionary parents. So sometimes I'm called a mish kid, and another word, description, label that sometimes applied to me is this idea of a third culture kid. Although sometimes I think it should be fourth or fifth. But it's this idea that I never quite fit in any of the cultures in which I live. So when I go to the UK, they tell me I have a South African accent. When I go to South Africa, they tell me I have a British accent. I don't speak very good Afrikaans, and my husband and my stepsons laugh at me. My Chichewa is even worse. But I very much consider Africa to be home. And this kind of muddle is really what's led me to think about the stuff I'm going to share with you today. I'm not a doctor and I'm not a priest, but my mother's a doctor and my father's a priest. And I grew up in an environment in which making a difference was the most important thing in their lives. My mum worked as a doctor in Malawi. When she arrived, she was one of 12 doctors in the whole country. She was 25 as a newly qualified medic, and she had to get her head around what that meant. The money that she earned paid for the petrol to drive to work and nothing else. So I grew up in an environment in which sacrificial investment of your energy and your skills for the benefit of other people was the norm. And I had to try and get my head around that because I didn't want to be a doctor and I didn't want to be a priest. But I knew that I should do something that's useful because otherwise why am I here? So I studied anthropology. I decided I'd do something I was interested in, and maybe that's my first little snippet to share with you is to follow your passion, and I loved my anthropology degree. And I sometimes describe myself as an activist because I am intolerant of things I don't like. Some of you were on a very early call with me this morning, and I confess that I'm a middle child, and I definitely suffer from middle child syndrome. So from the age of about 3, I would stomp my feet and tell my mum that life was not fair, that things were not fair because my sister had got something I wanted. And she would tell me life's not fair, and I would respond just like this, well, it should be fairer. We can do something about this lack of fairness. And I've never stopped that determination to do something when I'm not happy. So that activist comes through in everything that I do. I like to solve problems. I'm not very good at just sitting back and letting something that I don't think is right. And maybe because of this hopping around the world that I've done, which has not just included geography, but also different roles, I'm sometimes described as a boundary spanner. One of our colleagues from Cameroon was here recently, and he's taught me that I'm also a storyteller, and I wouldn't have used that label before, but I'm realizing that actually one of the best ways of sharing and has a very long African culture behind it is about telling stories. So I'll hopefully tell you some this morning. And as was mentioned earlier, I helped to establish the Africa Evidence Network, and I'm going to tell you a little bit about that now. And I love finding connections between people. And it's really exciting to have a new job where that's going to be what I do, build collaborations. So what is the Africa Evidence Network? There are some members here, and that's really exciting. And there are some people who are at our very first meeting. So we were formed in 2012 at an evidence event convened by 3IE, the International Initiative for Impact Evaluation, and the Campbell Collaboration in Bangladesh. And it was an Asian evidence event, and we weren't supposed to be there. But I begged my way in. I said, there's nothing in Africa, anything like this, and we'd love to be there. Can I come, please? And when I arrived, I realized there were about 20 of us there. And that was the beginning of keeping in touch, and the beginning of a network which now includes more than 5,000 people across the continent, and really diverse people. People who work in governments, people who work in NGOs, people who are based in Washington but do work in Africa, people who are community leaders. One of our very first members was a headmaster of a school who was interested in better policies in his school. And so the network's free. You can sign up if you're interested. You can go to the website. You can Google it and find it. At different times we've had funding, and at other times it's been a labor of love, a kind of Sunday afternoon project. But really now I've stepped away, and there are some fantastic new people running the network. And I think it's grown and been so successful because we've had really broad acceptance. We haven't said this is about randomized control trials. We haven't said this is about a particular hierarchy of evidence. This is any form of evidence and anyone who's interested in making a difference with evidence. And so we've got this really diverse group of people who come together and learn from each other. And we get together every couple of years for an event. We have newsletters and all sorts of different engagements. It's very light touch and high impact. And a really exciting network. So that's my background, if you like. Now, I wanted to talk to you about transforming evidence for policy. And I can't really do that unless I tell you first why. Because I think the why is what drives everything that I do. And if you haven't yet had a chance to think about your why, then I would really encourage you to do that. This is my beloved Lake Malawi, which is suffering from massive drought and climate change, and interventions to try and improve a real crippling poverty in Malawi are really struggling because of conflict and because of climate change. This is one of the reasons that I do my job. In Johannesburg, where I live, we recently had a really terrifying experience where a gas main underneath a main road, one of the really busy streets, exploded. Now, actually, the damage that was done was relatively small. But it was terrifying because it made us realize the depth of corruption and the lack of maintenance of our main services in a major city. There's a really busy road in Johannesburg. And it basically blew up. It exploded. And cars went flying and people went flying. And it was because no one had maintained the gas pipes that go underneath the road. And they had money to do it. So the money went somewhere. So this is really frightening. Infrastructure collapsing in the city in which I live. And I'm not sure I can even talk about the Middle East without crying, so I'm not going to go into detail, but oh my goodness, I cannot turn on the television without recognizing the world is not okay, and it's partly my responsibility to do something about it with the skills that I have. So really, if I think about why I'm committed to evidence for policy, it's because none of this is okay. I can't live with this without doing something. But I'm talking about transforming evidence. So I also want to talk a bit about why transforming evidence is a way in which I think we can tackle some of those problems. This is my PhD. Now, you'd think that submitting my PhD was a good day, but it was really depressing. You know, for those of you who have studied for PhDs and those of you who might think about studying for a PhD, it's a baby of yours, right? You nurture this for years, and it's never done in that nice, tidy couple of years. It always takes longer than you think. And the day I went to submit my PhD at the University of London, there were piles and piles of these theses propping open the door, propping open the windows. They were everywhere. There was hundreds of them. And I walked away so depressed, because I thought this beautiful piece of research that I thought was going to change the world is a doorstop. And let's face it, my examiners read it, and I don't expect anybody else ever will. So there's something wrong with the way in which we invest our energy in producing these things. Maybe it produced me a bit, not sure. I also have a whole set of academic papers, but I'm not convinced that they've changed the world much either, or that many people read them. And there's something wrong, and we know there's something wrong with the way in which we publish research. And many of you have seen this lovely map before. And Australia's doing a little bit better, but not an awful lot better. And that's my beloved Africa. There's a little stripe there. So the publication bias is geographical. It's to do with what kind of findings you found. It's to do with the language you publish in, all sorts of things. There's something seriously wrong with the way that we publish articles. Now, I've been told I'm not allowed to fire my paper airplane into the crowd for health and safety reasons. But I have a paper airplane, and I want to tell you why. So, you know, we talk about wanting to make a difference to decision makers. So this is the analogy that I use, right? The decision makers are over here, and I hope there might be some in the room, I'm not sure. Decision makers are over here, right? And they are focused on the problems, the decisions that they have to address. It's their life, it's their job, it's their KPIs, it's their work. I'm facing over this way. Academics stand over here. We don't get too close, it's a bit messy. And we hope that we're making a difference to those decisions. And we think that publishing an academic paper and kind of chucking it vaguely in that direction is going to make a difference. How? They're not even looking at us. We're not even talking to them, we're not engaging them, we're not coming round a table. My beloved colleague from Brazil, Laura Boera, says that knowledge translation is not about disseminating paper, it's about a table and sitting around a table. And I love that analogy that we need to be better at getting around a table. And my last little moan about transforming evidence is hierarchies of methods. Because it's a shortcut for saying my research is better than yours. Or maybe Professor so-and-so's research is better than somebody else's. Because we all know that we need the best kind of research that is appropriate for a particular question. And we also know that we need contextual information, and we also know that we need patient data, and we also know that we need lived experiences, and we also know that we need indigenous knowledge. So why are we still putting these pyramids up and saying mine's better than yours? it feels to me like it's a power game, and we need to be careful about playing power games which make other people feel like the data or the evidence or the lived experience they bring to the table is not good enough, because actually we're excluding people and perspectives. So, to be honest, this isn't okay either, and that's why I'm here, and it's what I want to talk about today. Okay, now I do know that in this room, we've got the best of the best when it comes to systematic reviewing, right? You guys, not me. You guys are the real geeks. You're the best. You've been working on this, you've been studying it, you've been practicing it, in some cases for many years. We all heard about how many years Craig had been in JBI yesterday. It's quite a long time. So you are the heroes, okay? And I don't want to diminish that, because we all have a place and a role to play, and we all bring something to trying to tackle these problems. We're here because we want to make a difference. We're here because we believe that research and evidence has a role to play in making a difference. And that's really exciting, because the potential in this room is fantastic. We're here because we understand that we need to collate and synthesize the best available evidence and not just rely on single studies. We're doing well. And we also understand that systematic reviews are not enough. Now, I don't know a lot about JBI's work, but I know that you're interested in and committed to the whole cycle of thinking about what the problem is and what kind of evidence is needed and how it can be implemented. So we aren't just producing systematic reviews. I need to acknowledge that this is not just so narrow as that. So I was wondering about getting audience participation, but maybe I'll just get you to think about this. I bet you've all got a favorite TED Talk. And if you haven't, it's a great conversation starter over coffee about why you like a particular TED Talk and what you learn from it. And this is my favorite. This is Chimamanda Adichie. She's a Nigerian author, and she has produced the most fantastic TED Talk. I'm wondering if anybody's seen it. It's called The Danger of a Single Story. I'm seeing there's at least one, maybe a few hands. She talks about racism, actually, and stereotypes. And she says the danger of a single story is not that it's incomplete. Sorry, it's not that it's inaccurate, it's that it's incomplete. And we know this to be true when it comes to studies too, right? Studies are not wrong, but they're incomplete if you just take a single one. So we talk a lot about the danger of a single study. And we know in this room that danger. And if you want an inspiration on thinking about that danger of stereotypes, then I recommend her TED Talk. So we could just keep calm and carry on, right? We're producing systematic reviews, we're thinking about the cycle in which they might be used, we're trying to engage with users of different kinds, which is all great. But what if systematic reviews are not really fit for purpose? Where does that leave us? And how do we tackle this challenge together? So I think we keep calm and carry on, but this shouldn't be business as usual. We need to be able to interrogate our own methods and our own approaches and really honestly, authentically, and genuinely question whether or not systematic reviews are going to change the world. Because I want to change the world, and I don't have time to do a systematic review that nobody's going to read. And I'm not saying all systematic reviews are not read, but that's my greatest fear. You know, that's the nightmare that I wake up in a cold sweat with. What if all this beautiful coding, hard work, critical appraisal that I'm doing that is exhausting is not fit for purpose? So I want to acknowledge that systematic reviews have come a long way, and there's amazing groups around the world who are trying to tackle challenges, whether they're methodological or social, and trying to address some of the challenges within systematic review methodology. So we know that user and patient involvement is really important. And people have put, I was hearing just this morning how much money the Canadian Institutes for Health Research have put into user involvement, and that's true around the world. So we're getting better at engaging with patients and users. We're getting better at doing systematic reviews outside of health, and I didn't really confess that to you earlier, but the systematic reviews that I've done are almost all outside of healthcare. I started doing reviews at the epicenter in kind of health promotion, and then I was there when they started doing the first work in education, and I learned a lot, mostly about how we learned a lot, mostly about how not to do it, because educationalists are very different from healthcare professionals. And then I did systematic reviews in international development. And actually, if you live in Africa in particular, but I'm sure it's true of any low middle income country, international development isn't a thing. We live in this country and we're interested in improving the outcomes for our citizens and our population. It's actually much more about cross-sectoral policy, whether it's economic or educational or social policy. We're interested in cross-cutting. So a lot of the work that I've done has been taking systematic review principles and applying them in other areas. And it's amazing how this has spread, right? An approach that was largely based in healthcare is now all over the world and is now very much cross-sectoral. And we've learned an enormous amount from that kind of work. And the investment is genuinely in evidence use. So there's, fortunately, a lot less paper airplane throwing when it comes to systematic reviewing. So we're doing a bit better. We know there's been amazing capacity building, whether it's in Australia or Canada or the US or Cameroon or South Africa. So we know there are more people who know about evidence synthesis and evidence use around the world. That's fantastic. In the world in which I live in, we don't call it capacity building, we call it capacity sharing, because we acknowledge that everyone who comes to learn also brings something to share. And when we've done work and we've called it capacity building, we've realized that actually we were being quite patronizing because the people we brought around the table to learn from us taught us far more than we taught them. And we know that this whole evidence movement is global. I mean, look around the room. It's amazing. And it's fantastic that we all get together. We know there's amazing software developments. And we know there's a whole set of other innovations that are trying to make sure systematic reviews are more fit for purpose. Amazing work around equity and gender, around thinking about whose data we're collecting and how and why. So there's been some great stuff in our field, and we should be really pleased with it. But I am worried that there is some kind of dangerous complacency going on. This is my 8-year-old daughter, and she's very hard work. She does not follow rules. If you try and play a card game with her, a chess game with anything, she makes up her own rules. This is her interacting with one of those giant chess sets. No, you don't line up the pawns, Mummy. These are characters in a whole new game that I have no understanding of, and that if I'm patient, she'll teach me. She rearranges the pieces and she will play for hours, and don't you dare touch those pieces and put them where you think they should be. She thinks completely out of the box and makes up a new game. And I think we need to get a bit better at that. I think we still like to line up the ducks of a systematic review, steps 1 to 10, and don't vary, because if you do, you'll somehow be getting it all wrong. Instead of going, okay, let's be an 8-year-old approaching a chess set and think about it completely differently. We tend to focus on how methodologically brilliant we are, and we are brilliant. Systematic reviewers are methodologists and we are very good at what we do. And we are very proud of what we do, and we like to polish our systematic review and share. And this is partly why these communities are fantastic, because we're with our friends and they know how hard it is to screen and they know what critical appraisal is and nobody else does. But we have to be careful because we are focusing on our own methodological brilliance. This includes me, by the way. I'm not just criticizing you. I've fallen through all these holes. Many of us sit in academia, and academia's rewards are all wrong. I'm not in a university anymore, so I can say these things, but when I was in a university, I physically got more cash given to me if I published alone than if I published with others. How can that be right? Like, the incentives are all upside down. And we spend far too much time trying to publish particular kinds of papers so that we can get our citation indexes up, and not thinking about the users of our research or how we're going to change the world with our research, but focusing much more on getting that publication done. It's all upside down, and we know it. I recognized a concern within the evidence field, which is about trying to institutionalize the use of evidence. And what that really means is academics sitting in their offices telling colleagues over here in government that they should change their systems and processes to use our evidence better. But we don't know much about policy. We don't know much about the practice that's happening over here. We're sitting there, and it's much easier for us to tell them what to do. And this is what prompted a paper that I'm going to tell you a little bit about, which is how I ended up here today. So before I do that, I just want to encourage you not to turn a blind eye to the issues within our own methods and our own processes. We don't need to undo everything. We don't need to throw away the baby with the bathwater, but we do need to be really open to the challenges within our field. So where do we go from here? Well, I've got 3 different areas that I just want to share with you. We need to transform the evidence production system and not just the evidence use system. And we need to think about how can we slowly work together to do that. And we need to transform systematic reviews too. We can't just say, well, our bit's right, the other bit's not. We have to think about what we need to change within our own methodologies. And last but not least, we need to acknowledge that change comes through relationships. It doesn't come through beautiful methodologies. I just want to unpack each of these 3 for us before we have a bit of a chat by the fireside over there. So this is a very high mountain. This is Everest. And I sometimes think that this is the biggest challenge, is transforming evidence production systems and not just evidence use systems. Now, my colleagues and I wrote a paper, and I don't want to go through it all because you can read the paper if you want to, and there's probably a number of slide decks that go with it. The interesting thing about writing this paper was that there's a group of 4 of us, and I've worked all over, as you know. My colleague Karina works in environmental science. My colleague Lawrence is a soccer player. He's very good at evidence. He came to South Africa during the World Cup in 2010 as a semi-professional soccer player to teach, what did they call it? Sport for development. So in theory, by teaching soccer to rural children, he was going to reduce the chance of them catching HIV/AIDS. What? Total nonsense. He ended up acknowledging that the program he was working on was crazy and coming to learn about evidence because he realized that the practice that he'd been funded to come and do, he loved playing soccer, but he wasn't changing the world. And Harsha Dayal is a colleague within government, and she is our muse. She challenges us all the time. And when we say, oh, we're doing this wonderful systematic review, she goes, oh, not another one of those. And she questions us and she challenges us. So all the best ideas within this paper have come from her. Let me run through our 10 proposals. So we argue that evidence-informed policy activities need to be focused on understanding and integrating this relationship between the evidence system and the policy system. We can't keep thinking that they're 2 different things. We need to think about them together. And we can't keep telling them over there to change their practice whilst we just carry on doing the same thing. We need to, and you guys know this, but we need to somehow communicate to the academic world that collaborative, cross-field, interdisciplinary, transdisciplinary work is really important. Societal challenges are not going to be solved by these ivory towers of single fields where we don't speak across. I know we need specialists, but specialists need to talk to generalists, or we're not going to solve the world's problems. We need somewhere in our academic structures to start to value policy-relevant research and participatory approaches. And when we're too busy putting our efforts into beautiful gold standard papers in Nature that have no policy relevance at all, then we're kind of barking up the wrong tree, right? So we need to think about these things. And we know, it's like a collective banging on the door, we know that we need greater recognition within our evidence production, research production systems of research synthesis, of collating evidence bases, of summarizing what we know so that we can not just inform decisions, but we can also understand what the gaps are in our research. Okay, number 5. We need better research agenda setting, and we need to be able to really shift how agendas are set within our research and innovation structures within our countries. We need to really understand this science advice approach. I don't know if you've noticed, and there might be some people here, but science advice to government has taken off. COVID really accelerated it, but it was happening already. It's really sexy. The politicians like it. They will pay for chief scientists. They will pay for mostly white men to stand alongside presidents and explain research to them or explain science to them. But if those chief scientists are not properly plugged in to the evidence synthesis world, then they're going to be introducing greater prejudice and greater bias and not the other way around. So we need to be constantly challenging and improving this science advice model. It's here to stay, so we need to really engage with it. Oops, sorry. My button's not working. This is one of my government colleagues' beautiful ideas. We have this idea of scientific advisors into the policy system, but where are our policy advisors within our science systems? Because we need them. I don't understand policy very well at all, and I'm guessing that many of you don't either, but yet we're busy churning out research, and we need to have much better connections with this policy environment. I read a blog recently that said that we had enough evidence centers and that we should move on to trying to connect them better. That's not true where I live. The evidence teams, there are fantastic individuals and amazing energy. We have some of the most dedicated evidence champions who I've ever met on the continent in Africa. And in fact, we have some in the room here as well. But we need stronger centers and we need more of them. And like Africa on its own is an enormous place. And we need to have greater investment and stronger bodies and teams of people who are doing this work. The last two on this, evidence for policy. So we need to think about research infrastructure that values bodies of science. We will only institutionalize the use of evidence if we think not just about telling them what to do to change, but acknowledging that we also need to change how evidence production is working and how we integrate them together. And of course, we need to learn. It is a huge embarrassment that the evidence-based field is really bad at tracking the impact that it has itself. We tell everybody else that you should be using greater evidence, but we don't evaluate or monitor our own work enough. So that's my last on this particular area of work. And if you want to go find the paper, you can Google it. Google my name and Transforming Evidence for Policy, and you'll find it. Okay, I've got 10 more minutes. We need to change systematic reviews too. I'm a bit nervous about talking about this one, but we do. We need to be able to step back and think about this beautiful thing that we build that is a systematic review. And we have to acknowledge that it's not enough to just craft this beautiful tree and put it on the hill and hope somebody will look at it. We actually need to get up close and look at the approaches and look at the strengths and weaknesses of what we're doing. And try not to just say, aren't we good? Because we're brilliant, but we're also producing something that takes a very long time and has a number of other flaws. We need to be able to do reviews that are faster. We can't say to a decision maker, sorry, it's going to take us a year. If they're going to make, this is the controversial one that I feel like I should hide and whisper. A gold standard systematic review is not a gold standard systematic review if it's 5 minutes late for a policy decision. It's like, why did we bother? It's not being used. It's useless. And yet we're busy polishing our systematic review to make sure it's shiny enough before we'll let anyone read it. 5 minutes late, and they've made the decision without it. We have to get better. There are some amazing people, amazing initiatives, many of them are in the room, to try and speed up this work, to try and think about how can we use machine learning, how can we use AI to speed up our processes, how can we examine those huge pools of search results so that they can be filtered down much more quickly. But game-changing technology will not change the game unless we let it. So we really need to embrace and examine and explore how we can get a systematic review that takes a year down to a systematic review that takes 2 weeks, because that's what the decision makers need. We need to think about how we can do that. We have to be demand-led. We're polishing our systematic review over here, and they're all looking at the problems over there. We have to be demand-led. Otherwise, we're just polishing our halos. Not sure. Living evidence provides some of the solutions, and everyone's talking about it. I wasn't here earlier this week, but everyone's talking about it. I was in Ottawa for the What Works Global Summit, the Campbell event. I'm not sure it should be called a global summit. Anyway, any of these things should not really be called global summits. I was at the Campbell meeting. Everyone was talking about living evidence. I have just started working with the Future Evidence Foundation, and many of you will know Julian Elliott, who's for some reason in Oxford and not in Adelaide with us. But he's been driving this. And really it's about, can't we produce evidence once, keep it up to date, and have many users? Can't we use that as an approach to tackle some of the mismatch between those people over there who are trying to make decisions and us who are busy squirreling away trying to code and screen and data? So we need to think about how living evidence might provide part of the solution to this and really embrace what does that mean and how do we make it work. And really, my answer to how do we make it work is we have to be more collaborative. It makes no sense. I don't know about you guys, but during COVID, we all did rapid reviews. All of us around the world, and we were all doing the same rapid reviews, and we were all looking at the same 5 studies, and then having a little panic when another study came along and trying to work out how to build it into our work. And we don't have the resources to do that. So we need to think about how can we collaborate better. I think some of the sexiest solutions to these problems are coming out of Africa and resource-poor settings, because we don't have money or time to do systematic reviews. Nobody ever funds us to do a systematic review. We're funded to do rapid reviews. We're funded to do evidence maps. We're funded to go and sit in government offices and help them make sense of the evidence. But we've been skipping the full systematic review approach for a long time. We have not found the right solutions, and we need to embrace some of these things. So I'm not suggesting that we've got it right, but there's some really exciting innovations that are coming out of resource-poor settings because we have no choice. Okay, last one. Ooh, pressing the wrong button? There we go. One more mountain for you. We need to acknowledge that the change that I'm talking about doesn't come about really through clever methodologists or even clever software. It comes about through focusing on building networks and building collaborations. And I just have one last bit of story for you. And it's really about thinking about where did we turn when COVID-19 hit. Because I said this in Canada, some of you might have heard me. I didn't go to the Campbell Library. I didn't go to the Cochrane Library. I didn't go to any systematic reviews. They didn't exist. I phoned a friend. And I happen to know some really clever friends. And that's what I did. We have this beautiful network across Africa, and I was able to phone colleagues who had dealt with the Ebola outbreak in West Africa. And I was able to phone colleagues in Uganda who were busy trying to work out what to do about education policy. And then I had lots of people phone me. It started off with parents in my kids' school, and then it became the head teachers in my kids' school, and then it became colleagues of mine from Cape Town who were having to address similar issues within Cochrane. And over time, many of us joined COVID End, this extraordinary initiative of over 50 centres working together. But what was key in all of that was the collaborations and the networks. So when people ask me where did I turn and my team in South Africa turn when COVID-19 hit, it wasn't systematic review libraries and it wasn't methods, it was people. And people who knew stuff, who could help me to find the right information. So we really need to think about how we can strengthen those relationships now. So people ask me, and I'll avoid the alcohol answer, which some of you have heard before, what would you do if there was going to be a pandemic tomorrow? And South Africa banned alcohol for a very long time, so I have promised my husband that if there's a pandemic tomorrow, I will stock up on alcohol this time. But actually, I want to know who to call, and I want them to trust me, and I need to find the people who I can trust so that I can phone. So if there's one thing that I would do differently, it would be about building relationships. We need to focus on collaborations and not kingdoms. And we heard from Will Moy, the new CEO of Campbell in Ottawa. This is about a mission and not an institution. So we need to build these connections, and not just within our own countries or our own continents, but across them as well. We need to avoid these ivory towers. And very last point, these are really small steps that we're going to take to start with. This is not a revolution, but it is. But it's a revolution in really small steps. It's about thinking together, it's about acknowledging that we have a problem and thinking together about how we might start to solve it. And who else is trying to solve it, and how can we work together? So it's a quiet revolution that I'm advocating for. And thank you very much for sticking with me all the way to the end. I really appreciate your attention. Thank you.
Thank you so much, Ruth. There's so many things in there that have resonated with many of the discussions that we've had with the JBIC earlier this week around the need to work together better, smarter, harder, to reduce, duplication, not be afraid to make friends across different networks, that we're all in it for, as Miloslav would say, for the Global Evidence Summit, using evidence and improving lives. So I have many, many questions. I've been scribbling away, but I have not a single question via the app. So Shane, but if you're afraid of using the app, we have 2 microphones here either side, so please be brave and come and ask Ruth a question so that I don't dominate all her time. So let's have a look. So you work across sectors and disciplines, whereas most of our audience here work within health. How has your experience shaped your understanding of evidence synthesis?
What a good question. I can say that because I fed it to her. It's really interesting. So when I did systematic review on microfinance, I didn't understand anything in the evidence. You can't search for the evidence in the same way because the titles are different. I couldn't understand the methodologies because econometricians, which is a word I can hardly say, do studies with completely different study designs. They don't do trials. We literally had to take each study and say who's getting the intervention, draw them on a piece of paper, and then think about what it was being compared to and what data was being. We had to reconstruct every study design in the massive piece of paper to just make sense. So it taught me that the language is different, but people are doing similar things, and that actually my set of knowledge is really narrow. But it also taught me all these common threads. And it helped me to step back and go, oh, okay, you're trying to solve a problem with the best available evidence, and you've collated it in this way, and what can we learn from it? And so it shifted in my mind, not just what's the best available evidence on a very narrow topic, which is how I'd been trained, right? I was trained by Cochrane. You just look at the study. You don't change a question, you just look at the study. And then I started doing reviews in other areas, and the task was different. The task was what can we learn from what's available, instead of what does the narrow definition of evidence tell us about something. So it shifted all sorts of things in my brain, made me panic a lot for quite a long time.
So following on from that, I think, not only have you worked across different sectors, but also you've worked in a lot of different unique geographical locations and obviously been instrumental in terms of evidence-informed decision-making across Africa. So, from your perspective, what is unique or different in the evidence field in Africa compared to other places that you've worked?
So we have colleagues here from across the continent, and they might have better answers than me. But what I've experienced, I'm trying to work out how to say this right. I've only been in Australia for 48 hours, and I've only been in Adelaide, and I've only been in a kilometre square. But I haven't seen any poverty. Not one person begging, not one person hungry, not even a car that looks like it could do being fixed. And I live in a different environment completely. The motivation to make a difference is on my doorstep every day. So I think there is something really crucial about living in that environment that motivates you. If you're going to make a change, you need to do it. There are people who are hungry today, so what are you doing about it? 30% of South Africans are hungry, and South Africa is one of the wealthiest countries in the continent. So there's serious issues, and I see them every day. Because of that environment, we also have, I'm not saying they're very good at always implementing it, but we have governments that have extraordinary national development plans and extraordinary priorities to try and tackle those issues. So the agenda that we work within all the time is we urgently need to make a difference. If you haven't seen it yet this morning, it'll be surprising. So there's a real issue. There's an issue that needs to be tackled, and that's, you know, forefront all the time. There's a really interesting thing within the African evidence ecosystem where decision makers, governments in particular, have been driving the evidence agenda. So we have a lot of demand-led work, and actually the evidence synthesis community has been found wanting. So we had this extraordinary experience a couple of times now where government has come to us and say, we want evidence synthesis on, and we've thought, we haven't got a clue how to do that. Human settlements. Can you do synthesis on human settlements? Can you do synthesis on land reform? And we've had to sit down and work out how to adapt the methods we know to a completely new area. And that's because government understands, within certain pockets of government, understands evidence synthesis coming to us for solutions, and we're the ones who have found wanting. And then the last thing I wanted to say was, there's this beautiful philosophy within the continent, and I'm sure that there is an Australian equivalent in probably any country that you're in, and it's called Ubuntu. And it's the idea that I'm only here because you're here, I'm only here because you're here. We are only who we are in the context of the community in which we engage. And that has, in some, not completely and not universally, but it has translated to an extraordinary sense of community within the Africa evidence ecosystem, where people really have shared and said, I want to learn from you, and got together. And it's created a culture for sharing and a culture for learning together, which is really exciting. It's really different, I think.
I love how you spoke about capacity sharing. I've written it down and highlighted it, and I'll be changing my language from now on, so thank you very much. Now, you've spoken a lot about building relationships, and I can see, you know, you're a very warm person, you're very easy to speak to. There are a lot of individuals in this room, I think, who are also here to do something that's useful and something to make a difference. I love the, you know, paper paint demonstration. Pity we couldn't peg it into the audience, but so what are your tips for people that it might not come as naturally, for researchers and practitioners in the room, on how to build relationships and or communicate? Where did they start with policymakers in particular in the context of this talk?
So I'm not sure everyone has to do it. I think everyone has to value it. So, you know, you kind of put together a systematic review team, and you know you need a statistician or someone who can do the meta-analysis. You often need somebody who understands risk of bias better than necessarily the others. And you do need someone who's going to spend hours retrieving all those PDFs to make them work. So we know we need different people in the team, and I think we really need collaborators and network builders and participants. We really need good communicators. But I don't think everyone has to be good at everything. If you relied on me for your statistics, there'd be problems with your systematic review, but I'm really happy to do the connections and collaborations bit. So I think it is about teamwork.
That's a really good way to look at it. We have one question via the app. Thank you, Zoe Jordan. How do you think we begin to overcome the issue of prioritising science over utility in evidence syntheses?
I'm not sure why you'd ever prioritise the science over utility. I think we need to be better at aggregating the use and thinking about potentially multiple users of evidence. It was really simple during COVID because everyone was asking the same questions wherever they were in the world. And I think we saw this extraordinary shift in how people talked about evidence and how people understood it. I'm not sure. I know that there are advantages in doing the kind of blue skies, laboratory research. There is, I don't want to downgrade science, but I don't think there is ever an argument for doing a systematic review for the sake of it. And I think we need to question, why are we doing this if we're doing systematic reviews for the sake of it? Because my lovely government colleague who I talked about, Harsha, when she introduces me to government colleagues, she introduces me as a public servant. She said, Ruth is also a public servant. And we are. We're either in a university using public money, or we're receiving research grants from taxpayers' money, or we're public servants too, and I think it's much easier to criticize the other public servants than ourselves, but I think we have to shift how we think about ourselves and the role we play.
Love that. Now, you've also spoken about a revolution in small steps, but in all of that is change. Now, we know that change is difficult, so we sit within universities and hospitals and governments, and there are rules upon rules and KPIs, and we've spoken about that a lot this week as well. So, we are in the business of change, but it is difficult. So why are you advocating so strongly for things to be different?
So I'm sorry I missed out on the conversations earlier this week because they sound really interesting. And so I'm responding in ignorance of what was said. But for me, it comes down to the fact that things are not okay. It's not okay with me that I have friends, acquaintances who will phone. And so I have a lovely friend who is a waitress who I got to know in a cafe, and she regularly contacts me. Her child is back in Zimbabwe, and she will message me and say, my child hasn't eaten today and I don't know what to do. And I don't want to eat because I know my 2-year-old hasn't eaten, and I feel terrible if I'm eating when my 2-year-old hasn't eaten. That's just not okay. It's not okay with me that especially because I have a kid the same age. It's not okay. And I think it's kind of, maybe it's a bit emotional and a bit me being who I am, but that's what motivates me to make things different, because I can't just focus on being a good systematic reviewer when my friend's baby hasn't eaten.
And I think, so I'm not sure if you know that JBI's logo is a pebble of knowledge being dropped into water and the small ripples. And Zoe read a poem at our welcome address to the JBIC meeting around how, how little minutes in the day add up. And so I think that there's a strong message in terms of everything that JBI stands for, and a lot of what you've said around that and the motivation that we all have and can take in terms of small steps. Now, I have one more question on the app, and then I'll finish with a bit of a challenging question. So, is the publication model broken, and should we abandon it? What about pure scholarship?
Yes, it's broken. We all know it's broken, right? You try and publish a paper, it's broken. So we also need standing and status when we engage with those decision makers. And sometimes that standing and status comes from being a published academic, or being Dr. So-and-so, or being Professor so-and-so. So I think we have to play the game. We have to publish, and we have to be able to get promoted within our jobs and develop our careers. If we threw that away, we would risk losing the credibility that we bring to the table when we engage with decision makers. But I have always tried to ignore my previous university's rule that said I should publish alone, because I just think that really is rubbish. I need to publish with other members of my team. I need to publish with people who are cleverer than I am, who help shape my arguments. I need to bring in young researchers who haven't published anything before to gain experience. So I wouldn't say abandon it, but I would say maybe there are elements of it that we can abandon. We don't have to chase the top journals, especially if no one's going to read them. And we can think about what we publish about. We can think about what shapes our research. And I hope at some point this very big ship of academic publication will turn.
Don't we all? Mm-hmm. And now, questions are all of a sudden coming in thick and fast. So we have, from Heather Loveday, probably a naive question, but policy is driven by political agendas. In a new system, can evidence for policy be politically neutral?
Can evidence for policy be politically neutral? I think we're kidding ourselves if we try to be neutral. I think we're bringing a particular perspective based on a particular set of knowledge. And Yes, the politics is complicated. We're not the politicians. We're not paid to make the policy decisions, but we do bring a particular perspective. So part of the reason I'm saying this is because we do a lot of co-production with our government colleagues, and when we do co-productive work, we are sitting down with our government colleagues and they're saying, here are the policy options that we have in front of us, and these are the outcomes within our National Development Plan, and we want to know of these policy options, which ones are going to have a greater impact. And we co-produce the evidence base. And if they say, which they did for land reform, for example, we want to learn from these 4 countries, we don't impose on top of that, that's not free of bias because you've chosen your 4 countries. There are political reasons for choosing their countries. But the research that we produce through that co-production model goes straight to cabinet. It's not disseminated, decision makers are in the room as part of the work. And so when people say to me, but your work is not free of bias, I struggle because they're right, but there's something about that pure ivory, we don't want to get polluted by politics argument, which keeps you over there. And if we want to talk to these people, we need to come together somewhere in the middle. So I think on the whole, we need to think about our biases and we need to share them and be open and discuss them, but we shouldn't pretend that we don't have them.
Or that they get in the way. So Yiti asks, from your experiences, are researchers and implementers keen on bridging the evidence use chasm?
Whenever I've been to a meeting a bit like this, where there's some decision makers in the room, especially if they're funders, the researchers love them. Researchers just want to talk to them. They want to talk to real decision makers. And when I've been to government meetings and been asked to present, and I've arrived and I've done enough homework to understand what it is they're actually talking about, so that I don't show up saying I'm Professor blah blah and I know, but I actually show up and say, okay, so I've looked at your National Development Plan and I understand what you're trying to do and can you talk to me? Then they also love that engagement. So in my experience, there is a real appetite for coming around a table and working better together. And we probably don't do it enough.
Now, from Kavita, policymakers need evidence in a very short span of time. What are your suggestions to bridge this gap, as systematic reviews can be time-consuming?
So I think we need to seriously look at why systematic reviews are so time-consuming and why can't we solve the problem. Because we could use different models. So we know we can use machine learning and those kind of approaches to cut down some of these volumes. We know they're there. We just need to we need to be brave enough to work with them. We also know, because it happened during COVID, that if we tend to have teams of 3 or 4 people. I don't know how big your teams are when they're working on systematic review. We tend to have teams of 3 or 4 people who work over a long period of time. But why aren't we working with 100 people in a 2-week period? Could happen. Why not? So I think we need to unpack this it takes a long time argument and just come at it, my daughter with her chess game, we need to come at it with fresh eyes and go, why is it taking us so long? Which are the bits that are taking us so long? My husband's a software engineer and he watches me go through this whole thing. He's like, what are you doing? Why have you got 10,000 search results that you're physically going through and trying to scan the abstracts for? He just looks at it in a totally different way. And he thinks I'm mad. So we have to kind of bring in these other fields and other forms of expertise and experience, and we need to make that.
And recognise that we're the ones who develop these methodologies, so equally, yeah, we do. So I also have a 8-year-old that challenges me on a daily basis, and so I loved hearing that analogy. And we've asked all of our plenary speakers here today to challenge us. That was the brief, right? Ignite our passion and ideas, make us think outside the box. So what is your call to action or challenge for our participants today?
So I knew you were going to ask this and I should have a really clever answer, but it's really hard. I think it is to have, like, scribble it on the notepad and stick it by your computer, to have the question of why am I doing this and why am I doing it this way at the forefront of everything we're doing. Because we kind of, it's like and I know our lives are so full and our diaries are so full, but it's like this roller coaster of running down the hill. And that picture that I put up on my very first slide of the guy trying to carry these blocks upstairs, it is really hard to turn around and do it a different way. But I think we need this, you need this sticky note on your computer that says, why am I doing this and why am I doing it this way? Just to keep that as like at the forefront of everything we're doing, to make sure we're not just following the sheep. We're asking a difficult question. Or
Going through the motions. So,
exactly.
Challenge delivered. All right, I hear coffee and I see a few tired faces, and so I just want to thank you so much for coming all the way here. We are so happy to have you here, and I personally was enthralled by your talk. I've followed you for a long time and I'm fangirling now, so I'm not going to stop. But this is a small gift of our appreciation, so thank you very much for it.
Thank you. Very sweet.